Hi, I'm Dr. Moya, and I'm going to be talking today about depression in pregnancy. Depression in pregnancy is very common. 8% of pregnant women are actually on antidepressants. So if you feel this relates to you, you're not alone, and I want you to know that. Depression in pregnancy can be really difficult to diagnose, and that's for a lot of reasons, but some of them is that the symptoms of depression can sometimes be mimicked by normal symptoms of pregnancy, like fatigue, which is very normal, or insomnia even. But when I get concerned about depression is when my patients start complaining about things like lack of interest in things that they normally like, or feelings of guilt, feelings of concerns of death, or even suicide. Feeling like they don't want to get up in the morning. These are when I get concerned, especially if it's been going on for more than 2 weeks. For patients that have mild depression symptoms, first of all, talk to your provider. Your provider wants to know this. They want to help you. And there's lots of different things that we can recommend to help. First things first, getting you in to see a counselor can be a huge help. A counselor can help you come up with coping mechanisms. They can help you internalize and work through your problems and make it very productive. The other thing to do is exercise. Exercise is a natural mood booster, and it's very underutilized, and it works. Being outside, sunshine, fresh air really can also help your mood. A lot of pregnant patients are concerned about talking to their providers about their depression, and it's complicated. A lot of people are concerned about the stigma behind depression. A lot of people are concerned about medications. But the bottom line is untreated depression in pregnancy can lead to decreased nutrition, which is not good for the pregnancy. It can lead to non-compliance with prenatal care because mom's just not feeling good. It can lead to lack of a connection with the baby and with family members. And these are all very important things that we want to make sure don't happen. Medications in pregnancy is something that is taken on a case-by-case basis. And the provider and the patient have to really come together to decide if the benefits outweigh the risks when talking about medications. Over the course of the last 30 plus years, we've developed a wealth of information from patients who were either on it and didn't know they were pregnant, or patients who were unable to stop it due to their symptoms. And we know that many of these medications are safe when their benefits are outweighed by the risk. These are all individualized, and you need to talk to your provider. For ladies who are on antidepressants and considering pregnancy, this is something you also want to talk to your provider about, because there's a lot that comes into it. Are your symptoms stable? When was your last depressive episode? These all come into the equation when you and your provider are trying to decide if you should stay on it, if you should perhaps taper off and start it back up again postpartum or after the first trimester. These are all reasonable options that you and your provider can come to together. The most important thing is if you're on an antidepressant and you find out you're pregnant or you're contemplating pregnancy, do not stop your antidepressant cold turkey. These medications need to be slowly tapered off under the care of your provider.